In front of Philippine Red Cross's cash grant beneficiaries in Subic, PRC Chairman and CEO Senator Richard Gordon expressed his dismay over PhilHealth's unpaid debt to the organization.
1,100,000,000 pesos. Lumaki na. Kaya, lalaki. Kasi mag-test ka lang ng 30,000, milyon na yan, 10,000,000 na yan. Hindi na binabayaran, hindi na pinapasin.
That debt now amounts to 1.168 billion pesos to be exact, said Gordon. This prompted the PRC to stop COVID-19 tests chargeable to PhilHealth since October 15. These tests were conducted for returning OFWs, those arriving in airports and seaports, frontline health and government workers, as well as those coming into the government's mega swabbing centers and more. Gordon said this took a toll on their procurement of $6 million worth of RT-PCR test kits from China. It also stalled not just the construction of additional molecular laboratories in various parts of the country, but the 24/7 operation of their existing laboratories. What's worse, it led them to borrow 2.6 million Swiss francs from the International Federation of the Red Cross and Red Crescent.
We're now doing it at no longer 24/7. Ang bayad namin sa MedTech, pinakamataas, 35,000. So hindi biro yan. No, they should pay the whole amount. Because mahirap, nakabitin kami.
PRC has 10 operational COVID testing laboratories. From October 8 to 14, they were able to test more than 65,000 individuals. But this number was cut by almost a third the following week since they halted PhilHealth-funded tests. They slashed the country's testing capacity by less than 40,000 individuals a week. Gordon said they used to test 11 to 12,000 tests per day, but has since shrunk to just a little over 1,000 per day. The DOH said several government laboratories temporarily filled the gap left by Red Cross. But Gordon still doubts the observed downtrend in new cases.
That's a stupid assumption. You know why it's stupid? Pag hindi ka nagtitest, siyempre bababa. Kasi the testing is going down. You know what I fear? More than the results of the test is that we may have to go on lockdown again. Once you get an outbreak again, business will slow down again. Can we afford that?
Former Special Advisor to the National Task Force on COVID-19, Dr. Anthony Liachon, is just as concerned, especially when it comes to meeting the target tests.
The target test is of 30,000 to 40,000. Of course, that's a target we all will suffer. You know that the testing is the cornerstone or pillar to reopen the economy.
OFWs were badly affected by the PRC suspension of its tests, with arrival even being capped. But Gordon said Red Cross is not to blame.
We want to test, but you have to pay. Anywhere in the world, you have to pay for your test.
But that may soon change. In a statement, PhilHealth said that it can now settle its unpaid obligations with PRC come Monday, October 26. That's after the Justice Department released its legal opinion asserting that the memorandum of agreement between the two agencies is not covered by procurement laws. Payment is subject to the completeness of PRC's billing documents and the Commission on Audits rules. PhilHealth says this should enable PRC to immediately resume its swab testing. For News 5, Greg Gregorio, we are One News.